Attendees are in listen-only mode.
Hello, everyone. Welcome to the webcast. My name is Christine Dorsey-Davis. I'm the Executive Director of the Ohio chapter of APA and Chair of APA's New Urbanism Division, and I am your webcast moderator. Today is Friday, July 14th, and we will be hearing the presentation, Mapping Food Access as Part of a Statewide Food Strategy. For technical help during today's webcast, type your questions in the chat box found in the webcast toolbar to the right of your screen, or you can call tech support at the 1-800 number shown in bold on your screen. For your content questions related to the presentation, you can type those in the questions box, again located in the webinar toolbar to the right of your screen. And if you would, please let me know who you would like to answer your question of the panelists. And we will answer those at the end of the presentation during the Q&A. On your screen is a list of our sponsoring chapters and divisions for 2017. Thanks to all the participating sponsors for making these webcasts possible and free to their members. If you're looking down the list and you don't see your chapter or division listed, please reach out to them and ask them to join us. Today's webcast in particular is sponsored by the Rhode Island chapter of APA. You can learn more about them at rhodeislandapa.org. And on your screen now is a list of our upcoming webcasts. You can register for these by visiting our webcast webpage, ohioplanning.org/planningwebcast. To log your CM credits for attending today's webcast, just head over to planning.org, log into your MyAPA account, and then in the search for CM activities function, you can either type in today's title or the webcast event number, both of which can be found on our webcast webpage. Again, ohioplanning.org/planningwebcast. And this webcast has been approved for 1.5 CM credits for live viewing only. We do have some recorded webcasts that are available for distance education CM credit, and you can check on those at our webcast webpage, ohioplanning.org/planningwebcast. And like us on Facebook, Planning Webcast Series, to receive up-to-date information on our sessions and when we post our recorded sessions online. And we are recording today's webcast. It'll be available on our YouTube channel later this afternoon. Just search Planning Webcast on YouTube. And we will have a PDF of the presentation available for you to download on our webcast webpage again at ohioplanning.org/planningwebcast. All right, I am going to now turn it over to today's panelists to get us started.
Excellent. Thank you, Christine. Hopefully my screen is showing. Christine, let me know if there are any issues there.
Looks good.
Thanks. Okay, great. Thanks everyone for joining us today for mapping food access as part of a statewide food strategy. First, I'm going to give a little bit of an overview of just sort of where we're headed today on the webinar, and then we'll dive in. We'll do some quick introductions. We'll briefly discuss the Planners for Health program and the Rhode Island chapter of APA. We'll give a little bit of a sort of intro to food systems planning and mapping and how that sort of framework applies to this particular project. Then we'll hear a little bit more specifically about food planning in Rhode Island from the Rhode Island Food Policy Council, the State Food Strategy, and the Health Equity Zone Initiative. And then we'll dive into the Rhode Island Food System Map, which is an online interactive map that we've created. So we'll give a little bit of background on that, our process in creating it, and then really dive into the map and show some of the data layers and some of the stories that are emerging from that interactive tool. We'll wrap up with some next steps and conclusions and then dive into some Q&A, and we look forward to your questions on that. I'll also note that when we get to point 6, next steps and conclusions, I'll put the URL for the map up on the screen so you guys could pull it up yourselves and kind of tinker with it if that pulls up any, or helps you sort of formulate some questions for us. So this is who you'll be hearing from today. I'm Ben Carrick. I'm a consultant at KKNP. Shana Cohen is also on the line from KKNP. Jeff Davis from APA Rhode Island. Leo Pollock from the Rhode Island Food Policy Council. And Sue Ann Dubois from the state of Rhode Island. I'll hand it over to Jeff.
Great, thank you, Ben. I will be very brief. I just want to welcome everyone and give you a little bit of an introduction on Rhode Island. I think people have a lot of weird misperceptions about Rhode Island or only think about us in terms of what else we are the size of. So yes, we are small, but that can be a good thing in our case. A lot of our statewide efforts, statewide coordination is really more akin to what you would experience in a large city or a county for a lot of you from other regions. Another thing that makes us unique is that we have a comprehensive planning law, so all 39 of our cities and towns, yes, all 39, have to have a comprehensive plan that is consistent with the state level, state guide plan. Another great thing is we all know each other. It's true, we're small enough that we all know each other and all the planning community works well together. That also means that we know all of our local and state elected officials, often on a personal basis, and in that respect, it can be easier to get things done on a state level. I will say our socioeconomics, for as small as we are, can be pretty stark. We have a really distinct urban-rural boundary, and we also have a lot of disparities in terms of income, race, health outcomes, and access to food in our urban areas versus our suburban areas. Next slide, please. We are very proud. One of Rhode Islanders' favorite pastimes is disparaging ourselves, but we've actually done a lot of great work on this issue of the intersection of planning and health. Just a little bit of background on what is Plan for Health. This is an effort of the American Planning Association and the American Public Health Association, funded with a grant from the Centers for Disease Control and Prevention. And these grants are awarded to communities who are working to improve the intersection of planning and health, generally with a goal of increasing health equity through either nutrition or physical activity. And Rhode Island already has a lot of experience with this, and I won't go into these in detail, but we have a statewide health equity zone, Healthy Places by Design, which has tried to infuse our comprehensive plans with health. We've got a lot of wonderful farmers markets, and of course the Rhode Island Food Policy Council, who you'll be hearing from soon, and their Rhode Island Farm to School Network, and so much more. So we really have a lot of things that we're proud of. We just have an issue of a lot of people in our state don't have access to that system, and there are definitely disparities to the access, and that's part of what we're going to be hearing about today. So thank you for joining us, and we're really proud to be demonstrating all this today.
Great, thanks, Jeff. Before we dive into a little sort of primer on food systems planning, just a quick note about who Shana and I are. We are with a company called Karen Karp and Partners, or KKNP. We are a food systems consulting firm. We work at the intersection of food, agriculture, and health. So we work with government, nonprofit, and business clients to develop projects and concepts that help build food systems that are more sustainable, equitable, and resilient. We are based in New York City, but we work across the country. And we have sort of developed the data analysis and mapping component and conceptual component of the project that we're going to be looking at today. So what is food systems planning? Good place to start might be, well, what exactly is the food system? This graphic sort of, illustrates all of the components that we might think about when we think about the food system. Most simply, you just might think about everything that food touches from the beginning of its life cycle to the end. Agriculture, distribution and aggregation, processing, marketing, markets, consumption, and then waste recovery. And you can think about the food system operating at any number of scales. You can think about the U.S. national food system, the global food system, or you can think about a food system operating on a neighborhood or community level. So this is kind of the lens that we start with when we're thinking about food system work and how all of these different components interact and connect with each other, as well as other sectors along the way. A few definitions to keep in mind before we dive in. This project has a particular focus on food access and food security, so wanted to share some of the key definitions there. Food security we define as access to healthful, affordable, and culturally appropriate foods at all times. And food access, in that vein, means both geographic or physical access as well as economic access. Many of you have heard, I'm sure, the term food desert. That's a USDA defined term. They also have sort of been moving toward using the term low income, low access area or LILA area. And that is defined as a low income census tract where either a substantial number or share of residents has low access to a supermarket or large grocery store. In 2015, over 83 million Americans, more than a quarter of Americans, lived in a low-income, low-access area. One sort of point on this, we find the food desert measure to be a helpful data point, but also not necessarily perfect, because in the measure, as the USDA applies it, they do not incorporate, for example, smaller corner stores, which in many cases, play a really critical role in neighborhood food access. And then finally, another sort of definition or lens we sometimes use is the food shed. And that is not a shed where you store your food. It applies the sort of watershed concept or catchment area to the food system. So the definition being the geographic area from which a population center draws its food. And Shana, I'm going to hand it over to you to talk about some of the different goals that can be pursued in planning for healthy food.
Excellent. So food is definitely kind of a crucible where all kinds of issues intersect and all kinds of goals meet. We wanted to just put this out there to present some of the kinds of goals that one could seek when creating a plan related to healthy food. It could focus on improving food access, as Ben was just describing, food security objectives or food access objectives. It can focus on at-risk populations or more broadly, whole populations. It can focus on local and regional food systems more broadly, thinking about in a holistic way about production, about land use, about zoning, about open space preservation, about manufacturing objectives, about career pathways. You can get into more there, as I said, jobs, economic development, and we put placemaking in here as well. Increasingly, food is being used as a tool to spur redevelopment of downtown areas, to spur creative reuse of infrastructure that is not being used. In Rhode Island in particular, there are a lot of mill buildings that have been empty for a long time that are now being reestablished with all kinds of innovative entrepreneurial food uses. And food around the country is definitely being used as a lever for placemaking, both in a back of the house way in terms of food production, food processing, food manufacturing, but also in a very public way as cultural places, as meeting places, as places where communities gather. And that feeds into this other goal of education and creating a culture of healthy eating. Really defining a place and defining a culture of a place and planning for that in the way the landscape is drawn out and created. Ben, you want to move it to the next slide?
Yeah, so, there can be a really broad range of goals. There's at least as broad a range of tactics or approaches that can be employed to pursue or advance those goals. This is certainly not a exhaustive list, but it provides some examples. Community and urban food production, farm-to-school programs, food policy councils, which you'll hear more detail about a little bit later, school and institutional food procurement or policy, inclusion in comprehensive plans, food sites as destinations, and farm-led conservation. There's really a lot of different approaches that we're seeing and have seen and continue to see that advance the goals of food systems planning. Shana, back to you.
So cultivating a food systems planning mindset, we wanted to pose these questions. Where and how does food fit in? Who are the eaters? Where are the sites of opportunity? Because all planning focuses on places, and all places that planners design are for people for the most part. We wanted to really just make the point that planning impacts food systems, and food systems are impacted by planning whether or not food is really carefully considered in the creation of a plan. almost any kind of plan that's being created has a space for food because of the fundamental connection to people. So we wanted to just put this in to make that point. The other point, Jeff mentioned the differentiation in Rhode Island between urban and rural and the different kinds of disparities that we see in health and economic opportunity and access. There's definitely an opportunity in creating food plans for rural and urban places to plan for food systems together. The natural or the obvious way of planning together would be that production would happen in more rural places and that more consumption is centered in urban places. But of course, you see more production happening in urban places as well. So thinking, I think, not just about a place that you're planning for specifically, but the geography that surrounds it, that food shed concept that Ben mentioned, is a really important mindset to sit in as a plan is being created, whether it is actively or a little more passively thinking about food systems. And in terms of sites of opportunity specifically, almost any kind of site can really be a place where food can be thought about in a mindful or purposeful way. Healthcare centers, medical providers, parks and open spaces, schools, emergency food resources like food pantries or senior meal programs or soup kitchens, housing and mixed-use developments, all different kinds of transportation nodes. The sites of opportunity are boundless for thinking creatively and strategically about how food plays into place and plans. Ben, back to you.
Great, thank you. So just wanted to wrap up with kind of a few really kind of casual observations about working in food systems planning. The first is that, of course, everyone eats. And that actually, I think it means that food can be a really effective, it's both a means and an end. It can be a really effective tool for community engagement. People have an experience of food literally every day, multiple times a day. And so I think it can be, everyone has an opinion, everyone has a personal and emotional relationship to food and what they eat, and that can be really, really powerful in community planning approaches. Related to that is that trust and relationships are really critical in food systems work, both between consumers and their retailers, or where they purchase or get their food, but also between farmers, or between farmers and their distributors, or between distributors and retailers. So in our work, we always find that it's super key to understand the levels of trust and the strength of the relationships that are occurring within the food system that we're working in. Food systems planning is also an inherently cross-sector or systems-based approach. Going back to that first diagram of the food system, you're looking at everything from agricultural land use to trucks on the road to public transit to where are retail locations being sited and how does that relate to zoning. It really cuts across many, many, many sectors within the sort of planning framework. So it can be really powerful and also challenging to do that kind of work. Related to that, it's really crucial to engage a range of stakeholders in food systems planning because any food system initiative that is created is going to affect a number of people, a number of types of people, a number of types of constituencies. So it's really critical to, as you're developing an idea or an approach, getting as much feedback as you can from as many, groups of constituencies or types of people that would be affected. And finally, this is sort of, I might call this a KKNP point of view on the food system, which is that supply chain diversity is key to resiliency. And what we mean by that is that we don't necessarily, think big is good or big is bad or small is good or small is bad, but a resilient and strong food system will have a diversity of supply chains, both large and small, big and long, and different kinds of actors in the food system to create something that really serves the community as a whole and is really resilient. And now I'm going to hand it over to Leo to talk about the Rhode Island Food Policy Council.
Thanks, Ben. I'm Leo Pollack. I'm the network director for the Rhode Island Food Policy Council. And just wanted to start with, if folks aren't familiar with that, just a sort of basic introduction to the term Food Policy Council. Food policy councils have been popping up at a range of scales, from community level, city level, state level, or regional. But really, it's sort of a community-based coalition or network, specifically looking at food and generally food as a system. This graphic, the Food Policy Council developed specific to Rhode Island, but you get the sense very similar to the graphic that Ben showed before on the food system. So sort of how are we looking at food not as just where it's produced or where it's consumed, but kind of all the pieces that connect that. So production, harvesting, processing, distribution, different sites of consumption, as well as sort of thinking about food waste and resource recovery and kind of circling, instead of a linear system, much more of a circular system with feedback loops. Really quick introduction to the Food Policy Council. The Food Policy Council started, as many did, with recognition that there was a lot of food-based grassroots work happening in the state. In 2010, a bunch of folks came together and started to recognize that we needed sort of more of a systems approach at the state level. That there was Division of Agriculture, people were looking at health, but folks from kind of across different sectors came together and said, seeing what's happening with Food Policy Councils, this is a real opportunity here. So the Food Policy Council was launched in 2011. I'll get into a few examples of the type of work we do, but it's a combination of things. Some of it's advocacy, some of it's working on regulatory reform, some of it's just education and community organizing, and we do work in close partnership with state government. Structurally, we are fiscally sponsored, so we're essentially a program of third sector New England, which is based in Boston, and that's given us a fair amount of flexibility as well. So with this, I'm going to focus on, Ben, we'll stay on this slide, sort of what's unique about Rhode Island from a food standpoint. And Jeff touched on some of these as well, but Rhode Island is one of the smallest states in the country, also one of the most densely populated. So that offers some opportunities and also some specific challenges. We are the ocean state, so obviously we have a strong fishing aquaculture industry. But fishing in particular, one of the notable things is the majority, so 90+% of fish are mostly exported. So there's not necessarily as much supporting in-state consumption. From an agriculture standpoint, obviously we're limited land-based, so the majority of our farms that are food producing tend to be more small to mid-scale. A lot of urban, suburban agriculture. Interestingly enough, Rhode Island has one of the highest kind of direct retail sales rates. So there's actually not a lot of agricultural production that gets sold into wholesale markets. There's actually a really strong farmers market presence, farm stands, community-supported agriculture, and that tends to be actually the majority of most agricultural operations sales here. We also, I think it's worth noting, Rhode Island, the capital province in particular, is really known as kind of a strong restaurant and culinary scene, and that we have a reputation for that. I think that's something the state has really embraced, and it's something that there's a real sense of pride of here. Given all that too, and this has been referenced a few times, but Rhode Island's urban core, we do see real disparities there, health disparities, higher poverty rates, and challenges around food access and food security. Then we can go to the next slide now. So to give an example of sort of what are the kinds of things the Food Policy Council has done over the years, we started with a food assessment when the Food Policy Council was launched. We worked with then CARP Resources, now KKMP. Just last year, we worked with KKMP again to do kind of a 5 years later update to that as sort of a foundation for the food strategy that you will be talking about in a minute that was just launched this year. Then we can go next. So another example, we for the last 2 years have produced these fact sheets on the state. So these are kind of snapshots of the food system. They're quantitative, so number of farms, number of fishermen, women, number of participants on SNAP and WIC, et cetera. But this has really kind of provided both baseline data. We did this for the state of Rhode Island and for all 39 cities and towns, but it's also served as an education tool. It's really giving folks a sense of kind of a snapshot of what's going on in their local community, and it gives us the opportunity over time to kind of track trends and see where things are headed. Go next, please. Another example, we worked in partnership with the Division of Agriculture through the State Department of Environmental Management. This is a public-private grants program that we've brought philanthropic dollars that match state dollars. So these are early stage grants up to $20,000, specifically targeted at new and beginning farmers, aquaculture producers, and fishermen women. We just completed the 4th year of this program, but this is a partnership that's ultimately invested almost $1 million into the food system over those 4 years, really targeting those early stage and kind of giving creative projects and opportunities. And my last slide. So what else does the Food Policy Council do? I was previous to saying sort of, I guess we bring people together in dark rooms. So this is an example of, we do community events. This was a farmer storytelling night at a historic barn in Rhode Island. And I think this is, I think Ben used this term before, that one of the core pieces is just community engagement, that bringing people together, having them break bread together, and finding time for them to learn more about the food system and really become more engaged citizens and participants in the food system. So that's really a core part of our work. And with that, I'm going to hand it over to Sue Ann Dubois, Rhode Island's Director of Food Strategy.
Thanks, Leo, and thanks, everyone. So I'm Sue Ann Dubois. I'm Rhode Island's Director of Food Strategy, and we're pretty sure that Rhode Island is the only state in the country that has a statewide Director of Food Strategy. Though if anyone on this call knows otherwise, please reach out. And so what is it I do? So this is a fairly new position for the state of Rhode Island, and I'm a little bifurcated. I have kind of 2 hats that I wear. One is I work out of the governor's office. I work for Governor Raimondo, and but I also work across agencies. And so the idea is to really de-silo food across state agencies. So everything from our Commerce Department to our Department of Health, Environmental Management, which Leo already mentioned houses both fisheries and agriculture for the state, and a number of other agencies like education, the prisons, human services, and the like. And so that's half of what I do. And the other half was I was charged with creating the state's first food strategy. And so what that is Governor Raimondo really recognized that food is such a strategic part of who Rhode Island is, our character, our history, our people. It's important for the health of our people. It makes Rhode Island a great place to live. And a whole host of other things, and that there is already so much, as Leo and others have already mentioned, so much going on in Rhode Island around food. Really take a good opportunity to look at the sector strategically and create a holistic food system-wide strategy of how we'll move forward. And so, Ben, can you go to the next slide, please? So I'm going to talk to you a little bit about the process of creating the strategy, and then what the core themes of the strategy, what the core themes are of the strategy, and then what the 5 major focus areas of it are. I'll do that all very quickly. So, Ben, can you go to the next slide? First, the process. So it was really, it's a state strategy, it's Governor Raimondo's strategy, but we really did it in partnership with folks across Rhode Island, really recognizing that there's so much going on across the state. We really wanted this to not just be a state strategy, but a Rhode Island strategy, kind of in the broadest way possible. And so we partnered a lot with the Food Policy Council on that outreach. And so this is just a quick synopsis of what that process was. So we started out with a listening tour where we met with, in one-on-one or small-in-one conversations with, this is 150, like between 150 and 200 Rhode Islanders, just talking about, what they did in the food system, everything from farmers, fishermen, food business owners, people who teach kids about food, people in the schools, people who run programs for food insecure folks, just all sorts of people across the state. We created a first draft of the strategy, which we rolled out at the Rhode Island Food Systems Summit, which we held last January 2017. We had a great cross-section of Rhode Islanders, and some folks from other states were there as well. And 350 is a lot for our little state, so that was a great, that really showed us that there was really appetite in our state to have this conversation and to have it at this kind of holistic level. We also obviously got written comment on the strategy, and we also, in partnership with the Food Policy Council, took it on a road show. So once we had a draft, we gave presentations and did outreach events across the state. And that's another way. Jeff mentioned that we're little, we're dense, but we're little. And so we really can get all around the state pretty easily and meet with folks. So these presentations were done in every corner of the state except for Block Island, which was just an oversight. And then obviously we also did research and analysis. We partnered with some of our regional counterparts and built it off of a lot of the analysis that came before, like the reports Leo was talking about. So Ben, next slide, please. And this is just the logos of some of the groups who were most engaged, in case anybody recognized any of them. Next slide. And then the strategy is really based around 3 core themes. So we really try and leverage these 3 things together, so environmental sustainability and resiliency, economic development, and health and access. And you'll really notice these 3 circles are the same size and that they overlap. We're really looking for opportunities in our food system to leverage all 3 of these core themes. It's not one at the expense of the others or 2 at the expense of one, but really areas where we can maximize all 3 in that little target in the middle. And so just quickly, the 5 major focus areas of the strategy are, if you could go to the next slide, yeah, perfect. Preserve and grow thriving fisheries and agriculture in Rhode Island industries in the state. So we already talked about, we have unique agriculture here in the state. For being such a small state, we have one of the biggest fishery ports, one of the most active ports on the eastern seaboard down Galilee. Please come visit. And we also have really active shellfish. We're also looking to, you can go, Ben, you can go to the next one. Kind of the flip side to growing ag and fisheries is really sustaining and creating markets for Rhode Island products. That's everything from encouraging more direct-to-consumer sales, connecting to institutional markets, supporting infrastructure, things like bottling plants or more livestock processing, and then also having a more coordinated message for tourists around food. So next slide. We also really want Rhode Island to be the place to be a food business. So we're looking to really grow the climate for food and beverage businesses here from a business standpoint. So everything from trying to tackle regulatory challenges to helping businesses access capital and fill some gaps, and really recognize a lot of the participants here in Rhode Island's food system. So next slide. We're also looking at the tail end, so really looking to minimize food waste and divert it from the waste stream, everything from source reduction to connecting potentially wasted food to Rhode Islanders in need, and also supporting technical assistance and other resources to help divert organic waste from the landfill. And that's a picture of a recycling facility. We'd love to see that kind of infrastructure, but for organics. And Leo, who you just heard from, actually runs the only commercial compost business in the state. So we love Leo. And then the next slide, and this is where we're really going to hone in. The 5th strategy is really around ensuring food security for all Rhode Islanders. And you'll see that addressing transportation barriers to access is highlighted. And so if we go to the next slide, one thing that we really noticed in trying to look at reducing food insecurity for all Rhode Islanders, we have this really great initiative in the state called Health Equity Zones. And so Health Equity Zones there's 10 of them across the state, and they're initiatives funded by the Department of Health in partnership with the federal CDC. And they're really looking for innovative place-based approaches to improving the social and environmental conditions of our communities. And so a zone can be as small as a neighborhood or as large as several towns together. And they each identified their own health equity issues in their own communities. Some of the common ones were food insecurity, opioid addiction, chronic disease prevention, and things like that. And all 10 of them actually recognized food insecurity as one of their major issues. And also were reporting to me that they would really like more opportunities to work together. And so we brought them all together. We've been meeting regularly with the food insecurity teams from these groups across the state. And something that came up constantly was they have all these anecdotal stories about difficulties with transportation as it pertains to food access. So things like, if the food bank is 10 minutes away if I drove by car, but most people in this neighborhood need to take the bus, and so it's actually a 2-hour voyage because the bus goes north, you have to wait, and then it comes back south. And so that kept popping up, and what we kept hearing from folks was, the real need to get some solid data that they could use both in their zones and also across the state, and not only have these anecdotal stories. And so that's where, we really needed some more data and mapping tools, and so that's where the Food Policy Council and Karen Karp and Partners really came in. And so I'm going to turn it back to Shana and Ben to talk about the really great mapping tool that we created, or that they created to fill this gap. If either of you are talking, you're on mute.
Good point, Sue. Thank you. This is Shana. So KKMP first got involved with Rhode Island and the Food Policy Council when the Food Policy Council was first in formation. And they wanted kind of a foundational document with the idea, you know, if you're going to plan to go somewhere, you have to know where you're starting. That was the goal of the assessment. Where is the state now? Now being at the time 2011. What was being produced there? What was being grown? What was the regulatory environment? What were environmental impacts from the food system? What was the policy landscape around the food system? What kind of jobs were people getting in the food system? And to what extent were those jobs with living wages? The food system touches so many different pieces and so many different issues and so many different goals, as we talked about before. We drew a different Venn diagram in 2011 than the one that Sue showed you that showed environment, economics, and health. For that first assessment, we really focused on the intersection between local food, so food that is locally grown and locally processed and sold locally, and access. And so we wanted to think about that intersection. We finished that report. The Food Policy Council came on, and unbelievable growth and changes happened in Rhode Island over the next 5 years. And that was the impetus that the Food Policy Council had to bring Karen Carbon Partners back on to update that assessment, which was a really unique opportunity. And the hiring of Sue as the state's first director of food strategy was definitely one of the key sort of banner upcoming events that update to the assessment was meant to support. Again, to have a report that she could look to at the very beginning before launching out on that very in-depth on-the-ground process of community engagement and learning to define the food strategy, to give her some groundwork and for the rest of the state to leverage as well. The map really grew as an outgrowth. In the update to the assessment, as different from in 2011, in 2016, when we went to look back 5 years and see what's happened, what we saw was that instead of focusing on that intersection between food access and local food, as the state had changed, a more meaningful intersection to look at in the way that where greatest need was being seen was between economic opportunity and public health, much more in line with what you were seeing from Sue. And that first shift really happened based on those 5 years of learning by the Food Policy Council, all of the work that they did at the policy level with community groups on the ground on every stage of the food system that was represented in all those different graphics that you saw. I'm going to turn it over to Ben to show you some of the static maps that we created for the update to the assessment in order to kind of graphically depict what we were seeing about that intersection between public health and economic development.
Yeah, so we wanted to look at some of those data sets and how they vary across the state. So we created a series of static maps. This shows a few examples. So on the left you see one that is economy and food jobs. Let's see, look at the bubbles over each municipality show food manufacturing jobs and food service and retail jobs. They are layered on top of the median household income for that municipality. And then the orange outline shows areas of the state where the unemployment rate exceeds the national average. Our food access and SNAP enrollment map on the right. The base layer municipality color coverage shows the percent of households on SNAP. The darker red is a higher percentage. And then we have layered on top of that some different food access points. So we have licensed food retailers in the state. We have WIC retailers, SNAP retailers, food pantries and meal sites. And then the sort of blue outlined areas are areas that were defined by the USDA as food deserts or low income, low access tracts.
For those who are new to food systems conversation and vocabulary, WIC is the Women, Infant, and Children's Program, which is a federally funded program that provides additional food support to women and young children, and SNAP is the Supplemental Nutrition Assistance Program, which is more commonly referred to as food stamps. Again, one of the biggest food and nutrition benefit program in the country.
Yeah, thank you, Shannon.
I also just wanted to point out, sure, I just wanted to also say that on this map, we also put in the licensed food retailers by number of cash registers, which is the way that that data was collected. And it's interesting, I wanted to just point out that the reason that's in there and put that way is that from a food access perspective, you can pretty reasonably make an assumption that a store that is a licensed food retailer, that the majority of stores that are licensed food retailers that have 6 or more registers are likely to have a produce section, which is to say they are foods that would, they're retailers that would be offering healthy food, not just some kind of food.
Agreed.
Okay, back to you, Ben.
Yeah, and I'll talk a little bit more a little later about sort of the various data sources and how those came to us. And then looking a little, shifting gears to the public health angle here, we mapped some public health indicators which were only available at the county level, so diagnosed diabetes, obesity, heart disease, and leisure time activity. And then we looked at access to health care. We had a layer that shows the federally qualified health centers across the state. And then the color coverage visualizes the number of healthcare and social assistance establishments per 1,000 households. So the darker green areas are better served in terms of healthcare establishments per person, or per household rather. Shane, I'll hand back to you to sort of talk about our shift in objectives from this set of maps to the sort of the mapping deep dive.
Yeah, Sue kind of covered it. I mean, after we had done this first set of static maps and worked through the update to the assessment, when the report was shared and when the maps were shown in so many different communities all around Rhode Island in a pretty community engagement process, what really stood out was this intersection between food access and transportation. And so when we sat down with Sue and Leo and others from the Food Policy Council to say, well, what is the next step? What is really needed? What do communities need in terms of mapping and data to really move forward strategically and to plan for improving food access in their communities? Transportation and where that intersects with food access was seen as the most important place to focus.
Great. So, we had finished up these static maps, and we knew that we wanted to go deeper on the mapping angle with those particular objectives or inquiries in mind. And there was a specific conference call that Shayna and I had with Sue and Leo, and I created these maps in QGIS, so that's where all of the data layers lived. And so we had this conference call and actually decided to just set up a screen sharing so that we could sort of walk through the data layers. And so we were all on this conference call. I was sharing my screen of the map, and the QGIS interface allows a lot of interactivity. And so, there was a lot of like, oh, pan over here and zoom in here and click on that. Wait, what is that figure? What's that store? What's going on here? And we sort of had this moment on that call where we were like, oh, this interactivity is so key to understanding what's going on and being able to investigate. And I mean, not to be too self-deprecating over here of this map on the right, but it's difficult to understand what's going on with this density of food retail locations. And so we, our initial plan had been to do a second set of static maps, and we really shifted gears and decided to explore the options for creating an online interactive map. And so that's what we did, and that's what we're going to show you next. So let's launch the map, the moment you've all been waiting for. So here we are. So we used the ArcGIS online platform for this map. There are some other options out there. There's Carto. I mean, you could do a really simple map on Google Maps. But we decided to go with ArcGIS Online. We had a license, and the sort of degree of interactivity and different features that it allowed was the right fit for us and for this project. So when you visit the map, you see this landing page here that tells you a little bit about the project. It tells you about some of the functions of the interface, contact info, etc. And then let's dive in. So this is the first thing you see. I'm going to turn off all of our layers here. And just to sort of walk through the interface a little bit, we all use maps online all the time, so it's pretty intuitive, but we have some zoom over here. You can type in any address and it'll take you there. We have a list of active layers right here, which you can toggle on and off. There's also a layer or legend window you can bring up, which just only shows the legend for the active layers, and I have no active layers right now, so it's blank. And then we also have a little info pop-up that has the same language that was on the splash page, but then it also has detailed info for the data sources and any other relevant info for all of our layers, where it came from, what the vintage is, etc. So back to our layers. So when you're thinking about food access, a reasonable first place to start might be, where are the access points for a person living in a community that wants to buy some food? So we have a number of layers that relate to that. I'm going to turn on food retail locations accepting SNAP and food retail locations not accepting SNAP. So as Shana pointed out on the static maps, we had a layer that was licensed food retailers. That's a data set that we got from the Rhode Island Department of Health, and it had this data point about the number of cash registers. I wish that every community we worked in had a data set with that detail or some other comparable detail. Not every community does, not every state does, and having that as a starting point for our retail layer was really, really valuable. However, the State Department of Health does not track whether each individual location accepts SNAP or not. So we got a separate list from the USDA that's publicly available to anyone. It's easy to find online of all retail locations that accept SNAP. We also got from the Department of Health layer for food retail locations accepting WIC. But again, that was a separate list from the licensed retailers. So it was a fairly painstaking process, but we combined all of those three lists into a single list so that we could have more control in the way that we visualize them. So as you can see at this level, there's a real urban conglomeration around Providence and in the center here. You can really kind of see the shape of the urban development of the state just by looking at the food retail locations. I'll also note that another point of functionality of the map is that you can click on any of these points and it'll bring up the name of the store and its address. So I'll turn those off. Another food access point layer we have is the farmers markets. This is a list that came to us from the Rhode Island Food Policy Council. And again, you can click on any one of these and it'll give you the name of the market and its address. And lastly, for retail food access locations, we have food pantries and meal sites. The orange is meal site, the darker color is pantry. You can click on any one of these. An important point about this layer is this came to us from the Rhode Island Community Food Bank. They update that list monthly, so they're very active in keeping it updated, which is why right at the front here we have a note with the link to that to find the most up-to-date list. The layer that's on here now I think is circa May, but we have what it is, pantry or meal site. We have the name of the location, a contact phone number, and hours and additional information relevant to that location.
We thought about this layer a lot because while we figured probably the biggest audience of users for a map like this would be planners and food system practitioners, people working at some level in the food system. But it's also available to the general public. And in the case that somebody might be looking at this map and thinking about where they might be able to go to get food, we wanted to make sure not to misdirect anyone. And so that was the goal in putting the food bank data in there in addition to the address. Emergency food places also have all different kinds of rules and regulations about who can participate. Some are open just to the community there. Some have rules about how many times per month a person can go and visit. And so we wanted to be very careful thinking about wider audiences to make sure not to direct somebody to a place where they might not be able to get food on a given day.
So the next thing you might be thinking about when thinking about food access is how do people get there? An important layer we have found in thinking about this is household vehicle ownership, and this is at the census block group level, and this, the data source for this is the US Census American Community Survey. So I'll pop up the legend here. This shows the percent of households in a given block group with no vehicle. Again, you can click on any of these to find out more detail. In this area, 77% of households do not own a vehicle, and that's a total of 634 total households. 0 there, 2%. And we have certainly found it valuable to have both the percentage or share and the total number, just because, you know, those can kind of mean two different things. You can have a high proportion but low population, or vice versa. 68%, over 400 total households, etc. So, you know, thinking about the people that are living in the state or these communities that do not own a vehicle, what are they using to get around? Well, we have a layer of the RIPTA, the Public Transit Association or Authority for the state, those routes. The two different colors are a regular route versus a park and ride, which functions more as an express. So this, you know, has been further helpful in sort of understanding the context of access between one area to another. We also have a layer that shows the stops themselves, which in a way, you know, it can clutter the map, but it also is really important for understanding that, like, some of these express sections, like there's a line there, but there are no stops. So that's important to know. So I think now we'll shift to another layer, the household SNAP usage. This is a pretty key data layer for this project. So this layer shows the percentage of households within an area that used SNAP within the previous 12 months. The darker green is the higher percentage. And again, when you click on any of these, it'll give you both the percentage of households as well as the total number. Zoom out to kind of get a little bit of a state perspective here. (42%), 32%.
You definitely, by looking at it this way, also see very clearly, again, patterns of urbanization across the state, which are pretty easy to see once those colors light up.
Then if we can, you know, so we're looking at household SNAP usage. Why don't we turn on food retail locations accepting SNAP? And I remember, you know, this Valley Falls area kind of catching my eye at a certain point, because this area kind of sticks out a little bit like a sore thumb here. And if we turn on the RIPTA routes as well, you know, not super well served. I mean, there's a route along the edge here. Let's see if there are any stops there. Yep, there are some stops. So, you know, this particular area has, looks like no points of SNAP retailer. Oh, there are some up here in the corner, but small ones. So, you know, just thinking about the experience of a resident living in this area, they're probably, you know, walking to the transit line, hopping on the bus, and maybe taking it up here to Super Stop and Shop. How long is that trip? You know, how long is their walk to the train, or the bus rather? Does the bus allow, you know, a significant number of grocery bags on the bus? There are all kinds of considerations in thinking about the journey to get groceries for a person living in an area like this. Another functionality of the map that I'll show now is the attribute tables that are behind all of this data. So you can click on this arrow here at the bottom, and we have the complete data spreadsheets for each of these data layers available here I'm going to turn off filter by map extent so we see all of them. So this is another way actually of interacting with the data and kind of discovering things about what we see here. So for example, if we go over to this layer that we're looking at now, household SNAP usage, the block group level, we click on the percent of households and sort descending. That'll get us the block group in the state with the highest proportion of households using SNAP. We can click to highlight it, and then we can zoom to it. And here we are in Olneyville. 85% of households, almost 400 total households in the area. And remember this, remember where we are, because it'll come into play a little bit later in our stories. Also, one thing, I actually haven't even done this yet, I was curious about which area has the highest total number. Okay, interesting. Looks like some high density housing here based on the Google Map base layer.
It's nice to be able to, we've found that it's really useful to be able to toggle between the graphic and the data and to launch from a point of curiosity that it starts in either of them. With the map shows gradations. But once you get above a certain percentage level, it doesn't show a different gradation between a community that is say 65% versus 90% dependent on supplemental nutrition assistance program benefits. And so it gets really useful when you start to see where all those dark areas on the map are, where there's the greatest density of people who are experiencing food insecurity, to start to get to that level of detail within the block group of where that is felt the most deeply.
Definitely.
In some of the health equity zones across the state, they have gone deeper than the block group level and have looked at the block level of census data to really identify pockets of poverty in the state where poverty is felt most sharply. And I think we're going to zoom to one of those in a little bit, but I wanted to just mention that as we're starting to toggle between the data and the graphics as a way that the two can be used together.
Great. One other layer I want to have a look at real quick is the low income, low access areas layer from the USDA, aka food desert. And the USDA actually released a new data set for food deserts or LILA areas earlier this year. So we decided to sort of look at what that change looked like from the earlier data set that was released in 2013 to 2017. So the orange tracts here were, you might call them persistent food desert areas. They were deemed such in 2013 and remain so this year. The blue ones were formerly deemed that and are no longer, and the yellow ones are new. We don't necessarily know what factored into each of these changes. Maybe a store opened or closed, or maybe the poverty level in a given census tract went one way or the other across the threshold. But it's interesting to see how the assessment of low income and low access across the state has shifted from 2013 to 2017. And another data layer to look at is poverty. And this is a slightly different visualization that I'll explain. So this is percent of population below the 185% poverty level, and we use that as a threshold because it's often used as a sort of rough proxy or indicator for SNAP eligibility. So the color, go ahead, Shana, were you going to jump in?
I was just going to say it's also the percentage that's used for children in the public school system for free or reduced access to meals at schools. 185% of the poverty level is the defining line.
Yeah, thank you. So the color of each bubble shows the percent of population below that line, and then the size of the bubble refers to the total population. So this is kind of interesting, you know, looking at a place like Newport, where we have a small bubble here, small but dark. So over half of people in this tract are living below that line, and that's 250 people. And we might look at a bigger bubble here. So it's more people. It's almost 1,000 people here, but it's a lower proportion. So that color isn't as dark. So understanding sort of those different dynamics can be important for understanding how this plays out. And then I think the last sort of combo of layers I wanted to look at was childhood poverty. Zoom out a little bit here at the state level. And you know, so if you click, it'll tell you the percentage of children and then the total number of children in that area that are living in poverty. And then we also have the WIC office locations across the state. And this is actually interesting in that, you know, particularly some of these rural areas with higher child poverty rates don't appear to be especially well served by the locations of WIC offices. And Shana, I think you know a little bit more about sort of WIC use in Rhode Island?
For families participating in WIC, in addition to trying to find a store that is a WIC program participant where they can use WIC benefits to buy food and other things for babies and families with young children, families also have to go to a WIC authorization office pretty regularly, sometimes as often as every 3 months. And so thinking about how WIC enrollment or authorization or registration offices are located throughout the state and how that relates to where there's a density of children living in poverty can be a really important planning tool for the state to use in thinking about WIC enrollment, which in the state of Rhode Island is a pretty underutilized program, whereas enrollment in the SNAP program in Rhode Island is very high. It's a very well utilized program by those who are eligible for it. WIC is very underutilized. And this may or may not be one of the reasons for it, but looking at a map like this can really help to understand when you think about it alongside the protocol and other kinds of requirements of any given program can really help to think about how something is or isn't used compared to how you want it to be used.
Great. So I think that we've looked at all of the layers now, and because I want to leave enough time to answer some questions at the end, I'm going to shift to one story that we have about how this map has been used in the real world. So just a quick note, so the Rhode Island Public Health Institute has a program called Food on the Move, and it is a mobile produce market that operates across the state. It's one vehicle, and it makes 9 stops each week. It does 2 markets a day for 4 days and 1 market a day for 1 day. So the Food on the Move program works closely with the health equity zones across the state to identify, you know, the best locations in a given municipality to set up their market. They go to community host sites, schools, libraries, community centers, etc., and set up their market for the 2-hour window or so for each stop. But it's not always so easy to identify, you know, what the best location is for, you know, where to set up the market on its visit. One key point about the Food on the Move program is they actually offer for people that are using SNAP. There's a double your SNAP dollars program. So if you are using SNAP dollars and you go to this market, you can use $5 of your SNAP dollars, and but it's worth $10 at this market. So their sweet spot is a location where there's a lot of people that have access to it with a high density of people enrolled in SNAP. But they weren't really, in their site selection, they weren't looking at SNAP enrollment data because I don't think they, you know, had access or a tool to do so. So they were mostly selecting their locations based on qualitative, conversations with the health equity zones or other community groups. But since our map went live, they've been using the map and have a couple of examples of the way that it has either changed their approach or confirmed the location that they're using is a good one. I'm going to go to household SNAP usage because that's the most relevant layer for this. So starting out with North Providence, first they were distributing at 1135 Mineral Spring Avenue. Let's see what that looks like. So it's in a light gray, which indicates that there's not some immediate high need. There's some dark green down here, but this doesn't look like it's in the heart of a high need area. And I think they were having not a super successful or a lot of response at that location. So they ended up changing, shifting gears to 11 Emmanuel. And this one's kind of interesting because at first blush, this doesn't look that like a high need area either, does it? But the previous site, there was a lot of response that it was really hard to get to from RIPTA or whatever. The way that the RIPTA routes were structured, that location was not good from a perspective of using the bus lines. But let's look at this location with the RIPTA route layer right next to a RIPTA line, and it in particular provides great access to the Greystone and Centerdale neighborhoods, which are up here and down here. So it's interesting because it itself is not in a particularly high need area, but it's positioned well between two high need areas with a RIPTA line going right between those areas and right next to the site. So that has been a success story for them. The other site that I'll show was more of a confirmation, and this is Olneyville, which you may remember is where the location of the highest proportion of SNAP households in the state is. So you can see this block group here was the one that we looked at earlier, the highest ranked in the state. The site itself is located in another dark green area. They were already using this site before our map went live, but as soon as they saw the map, they were like, oh, that's why that's such a successful site. And actually, based on the success of that site, as well as the sort of confirmation that was provided by this map, they went from a monthly market site to a weekly. So they literally quadrupled the level of service for the residents of this area based on both the data and the qualitative perspective of access for this neighborhood. So I'm going to shift back now to our PowerPoint and hand it over to Sue to talk a little bit about some next steps. But first, I'll just point out at the top of the slide here, we've got the URL. If you want to go check out the map now, go for it, tiny.cc/RI-foodmap. And we look forward to answering your questions. But I'll hand it over to Sue to talk about some of the next steps for the strategy and the map.
Awesome. Thanks, Ben and Shana. And so I'll be quick because I know we only have a few minutes left for questions. But first I wanted to say, So first I wanted to just really thank Ben and Shana because this started off, as I mentioned earlier, like a fairly specific request from the HES communities for the health equity zones for more, for some mapping and some better data. And they produced this, which was beyond our wildest dreams, very quickly. And I shared it with the HESs just a few months after they had said, hey, it might be useful if we had this. And they were both shocked by how quickly it was created, and then two, by how much it really met their needs and how they've added things to it since that first iteration. So things like Ben was showing you that you can pull up the data and the spreadsheets that underlie all of the mapping. That has been really vital for them. And so we're looking at, since the map has really stretched beyond what we had originally envisioned. Like we were thinking, as Ben mentioned, just a few static maps or, you know, just something to kind of illustrate the things we were hearing, and it turned into this much more useful tool. The plans for its use have also expanded and will be a really important tool in our implementation of Rhode Island's food strategy. So a few things I wanted to note for future usage of the map and how it will relate to the food strategy. So first, we'll be doing kind of a public launch of the map in partnership with the Food Policy Council in mid to late August with the and in partnership with the Rhode Island chapter of the American Planning Council Association to really release this to the Rhode Island planning community, as well as some others who work in food insecurity issues across the state, to say, here's this tool we've created, that these are, by we I mean Ben and Shana have created it, here are the ways we think you can use it, you know, how could this help you in your planning efforts? A second is that the governor will be announcing later this summer the formation, and this was in her food strategy, of a hunger elimination task force. And one of the key things that task force will be charged with is really responding to and participating in the statewide planning's long-range transportation initiative that they just started, that just got underway. And so really being able to provide that health and food access perspective and using this mapping tool as part of what will inform the task force's response and participation in that long-range transportation planning initiative is a big piece of how we'll continue to use this map. And then I've also been hearing from the HESs that, you know, this is a tool that's really useful for them, both as they do the health equity zones, both as they continue to work in the community, but also as they, you know, really try and educate other folks in their communities about what's going on. So it's not just useful for them, but useful as a tool for really educating the planners in their communities, government officials, and others in their communities to say, look, here we can see it because you can go down to the street view. You know, here on Main Street, this is what's happening, or here on 5th Street, this is what's happening. Really like street by street. And so I'll stop there. There's a lot of really exciting uses for this tool, and both for planning and for implementation. And so would love to hear if you guys have any questions or however we can be helpful in sharing this really great resource that Karen Carpenter Partners has created.
Thanks, Sue. And just pointing out our contact info all there across the bottom. And then I just pulled a handful of resources, not exhaustive, of course, but the APA Food Systems just actually recently announced a knowledge base relevant to food systems. The URL is there. The APA has a food interest group called FIG. You can check out the website there, apafig.wordpress.org. Growing Food Connections is a really great project. It's really comprehensive, actually. Has a number of case studies, but it also has a food systems policy database that's really extensive. And then the USDA Food Access Research Atlas is where the food desert data set is located, and then the Food Environment Atlas is not as granular. I think it's only down to the county level, but it has a number of other food environment measures and an interactive map platform there. So thank you, everyone.
Can I add one more thing?
Yeah,
sorry. I totally forgot one quick thing. Was another use that we'll be doing is, so this started from folks having stories and needing data to back it up. And one thing that we're looking to add now is how can we build stories into the map? And so we're looking to create kind of a story mapping tool where, and this is still in development phases, but you know, where you could click on parts of the map and maybe you hear an audio story or you see a link to a story to really merge those two ideas, that you really need both. You need the storytelling and as well as the data. And so to have them in a similar or parallel tools is something that we're exploring next in partnership with the Food Policy Council. And one resource that we forgot to list, which is my bad, if anyone's interested in the statewide food strategy and statewide food planning as a state effort, you can find the Rhode Island food strategy on our website, which is relishrhody.com, or you can just shoot me an email and I'm happy to send it to you or talk to you about that process. So I'll be quiet now.
Awesome. Thanks, Sue. And Christine, I'll hand it over to you to handle questions.
Wonderful. Thanks, guys. Yeah, and we have some coming in. Again, everyone in your GoToWebinar tool panel, and please tell me who you'd like to answer the question if you have a preference. Okay. First question, back towards the beginning of the tool, what about stores that use square or non-traditional means of monetary transactions? Does your data pick those up? I think that's referring to your comment about if there's 6 or more registers, then you assume that there's produce.
I mean, if it is a licensed food retailer in the state, it will be on the list. In terms of number of registers, we certainly don't take that to be a final and perfect measure of whether a store has produce or not. And certainly many small single register stores do have produce. But yeah, I guess, I don't know, Shana, would you have anything else to add to that?
The data does not specify about the kind of register at all, and I can't see why it would be different depending on how many different, what tools they're using for that. But I also think, the main rule of thumb that we were using was just that those with the large number of cash registers would be full-size supermarkets. And I don't know of any full-size supermarkets that's using an other than register kind of point-of-sale technology for checkout. In the future, I would imagine that kind of data would be necessary to separate out and would be able to think of, would be important to look at. But at this point, we were not able to get that kind of information, and in terms of identifying at least loosely where full-scale grocery stores are, I don't think any of them are quite there yet.
Okay. Related, I noticed the food retail locations you clicked on appeared to have gas stations or convenience marts. Did you distinguish between grocery stores, supermarkets, and gas station convenience stores? Why or why not?
Excellent question. So we did not, except to the extent that number of cash registers are a pretty good indicator of at least what is not a gas station. Because I don't know of any gas stations that have 5 or more cash registers. But certainly within that, within the category of 1 to 2 cash registers, that is capturing both. That could capture a small produce store as well as a gas station. And the reason that we did not differentiate is simply that that didn't exist in the data set. That differentiation does not exist in the data set that we used, and to differentiate across the state, I don't remember the total number of retailers across the state, but it's probably, I think it's between 1,000 and 2,000. We just didn't have the bandwidth or time to be able to inventory and sort all of the retailers at that level. So I think the best that can be done at this point is if someone is looking at a specific location and a specific retailer or set of retailers around it, is to click on those on the map and see if it's able to tell from the business name whether it's a gas station or some other kind of retailer.
Ben, this is Leo. I think this is also, I put up before the slide where the Food Policy Council did fact sheets. This is also sort of the same questions and struggle we had there, where what's hard is certain gas stations may have almost sort of milk, bread, even some produce. Some may just have sort of packaged food. It becomes a really our sort of gut, I think, with this map and with the fact sheets was to present that data as it came from the source, and not to selectively decide this should be included and this shouldn't, but to try to be transparent based on name, location of where that is. So it's more providing that information, not necessarily filtering it or putting a judgment on, oh, this is serving food, or this this would count as a food retailer, and we're deciding this doesn't. Because then it really starts to get into, we're making arbitrary decisions about how that data is presented, where I'd rather just present it based on actually how, in this case, how they're regulated.
A similar question came our way when in the community engagement process with this map about restaurants and why we didn't include restaurants as food access points on this map. And The reason was somewhat similar to what Leo was describing. We didn't because restaurants they're generally not really included in the food access kind of conversation. Primarily in some ways because of price point, in some ways because it's of a judgment issue. And chain restaurants would have the same kind of you'd be able to see chain restaurants on a map in the same way you would a number of registers, and you can make some but not necessarily accurate assumptions about what food is offered at a restaurant based on the number of locations that were there. And we didn't include that layer because A, we didn't see the restaurant sector as completely as fundamental to food access as the food for home category of retailers, but also because of that question of judgment and what is learned by putting it on there, and what can you learn if you're not separating out data in a way that judges one kind of food differently than another.
Great, thank you. Next question. How often are the food access map layers updated? The location of food retailers, i.e. the number of cash registers, changes often as stores go out of business, store ownership changes, etc.
Excellent question, and that's something that we have talked about, and I think we don't necessarily have a final plan. And I think to Leo's point about transparency, that's really, I think, something that's key to our approach on updating the data, is letting people know, exactly what the vintage is of the data, and the fact that these things change. I mean, I think with the retailer list especially, because it was such a painstaking process to combine those three lists into a single list, I think, our sort of maybe draft or tentative updating plan would be to do that annually. And just note that, a more up-to-date spreadsheet is available on the Department of Health website. But it's, that's a challenge. And I think that at least for now, our best approach is to just be clear about what the vintage of the data is and note that these things can change.
Thank you. Is the Food on the Move a year-round program, and does the state contribute to its operational costs?
I'll kick that one to either Leo or Sue.
Hi, this is Sue. So yes, they are year-round. A note about them not being year-round, so they do offer local produce at their markets, but they also offer non-local produce and a lot of culturally specific produce. So if they're in an area with a lot of African immigrants, they might have, some produce that's more relevant to those communities, as opposed to when they're in areas with a higher percentage of Latino population, they'll have food that's more relevant there. So they have both local and non-local produce. So that also helps them to operate year-round. So it's great to support the local produce, but in off-season times they have both. And the state provides some support to them through their, because they're active as part of the Health Equity Zone initiative. So they get some funding, but they do a lot of, they're connected with the Public Health Institute, and so they also do a lot of research, and they get funding by folks like the National Institute of Health, USDA, and a number of other larger funding sources as well. So there's some support from the state, but also some lots of other support from other places.
And where can we find more information on the Food on the Move program?
If you email me, I can send you more information, but also you should be able to, if you just Google, they have a website, so Google Rhody Food on the Move as part of the Rhode Island Public Health Institute. There'll be tons of information about their program, but if you need some help, feel free to email me and I can connect you with folks there.
Thank you.
Ben actually has their website pulled up.
Yeah, their website's
pulled up. Ben already pulled up the website, so there it is.
Thank you. Okay, next question. Is there a way to get data related to sales volume of produce at the locations on the map? It might help understand cost factors and whether people actually purchase produce from the mapped sources.
Oh, that would be amazing. That would be a dream data set.
I'm giving myself.
Yeah, I mean, the short answer is no. Shana, retailers tend to be very protective of sales data like that. There are some proprietary data sets out there that you can purchase that will give you like gross sales volume for an entire store, but it definitely, I've never seen a data set that breaks it out by product type unless you were going directly to a chain and asking them if they would share it and crossing your fingers.
Yeah, I haven't seen a data set that separates it out either, but it is a great question and raises the possibility of potentially partnering with retailers who are most present in a given area to see if they would be willing to give that kind of information, you know, participate in a process of, you know, understanding how it would be displayed in order to inform plans around food and access. It really would be a dream data set.
Yeah, there are also some data sets out there, and I can't think of them off the top of my head, but I have seen them that estimate fruit and vegetable consumption like on a geographic basis. So I think maybe the lowest I've seen is at the county level, but it'll estimate you know, the fruit and veggie serving consumption of a population within an area.
Okay. Have you considered a more detailed collection on food stores within close proximity to target areas as in high SNAP and WIC usage?
Great question. I don't know, Leo, Sue, have we thought about that?
I'm not totally sure I understand the question.
Yeah,
Is the idea, go ahead, Leo.
I was going to actually ask the same question. Was it in targeted kind of high-use SNAP areas? What was the first part?
Again, have you considered a more detailed collection on food stores within close proximity to the target areas? As in, are there established high SNAP and WIC usage areas? And then within those established target areas, is there a way to get more detailed information on food stores?
Oh. Well, the map already has all of the licensed food retailers for the whole state. And so one of the ways that the health equity zones are looking to use this is to work with their local stores to identify parts of their communities where like maybe they're you know, there are high concentrations of people on SNAP or high concentrations of poverty without access to a grocery store, and say, you know, would corner stores or some of the stores that are located there be potentially interested in offering more healthful options and more fresh options or frozen vegetables and things like that? And that's a project that the Department of Health for the state is supporting as well, and they've developed some surveying tools to find out if they're, you know, what and if there are, which we assume there are, and then what are the barriers for corner stores and small stores to offer healthy items? Is it things like, do they not have refrigeration? Can they not take the risk on new products? Do they see their clientele as being mostly people coming in for a snack, and so it's not worth having healthy options? Or, you know, is it that they would offer them, but for the fact that they don't have a fridge or they don't have a what? And, you know, are there ways that the state and others could support them in acquiring whatever it is they need to get over that barrier if they think that they could do that? And so that's one thing that we're looking into, and really working, because the health equity zones work with community leaders down at like the very granular, like on the street community level is the point of the HESs. And so really letting them kind of identify who some of those store owners or some of those locations will be. And the city of Newport, which most people associate with mansions and the beach, also has a really very bifurcated community, also has a high percentage usage of SNAP in some neighborhoods. And so they've actually piloted kind of healthy retail with a corner store with one of their local corner stores down in Newport. And so they're kind of sharing their lessons learned with the rest of the HES community as we kind of roll this out in a few other communities. So that's one way we're looking at that, but there isn't a lot of more data we could really collect, because as Shana and Ben already mentioned, retailers don't really necessarily want to share with us, like, or with anyone, especially not state regulators, all of their business data, like how much they sell of X, Y, and Z. And so some of that can be really hard to come by.
I could imagine a future iteration of the map where, you know, if potentially the highest density SNAP utilization areas where it would be worth going through the data sets for those areas and distinguishing, as one of the first questions pointed out, between different types of retailers in a graphically different way, or making that a subset kind of a map. You know, where to focus only on those and do the layer of data cleaning for to make a map that would highlight the differences in those areas. I think that's what the question is getting at, and I could see that would be an interesting map to make for sure.
And I mean, to that point, sorry, I think I had totally misunderstood the question. To kind of that point, if we do identify as we use the map that we need more data from, like, on exactly what types of stores they are, and are they just at grocery stores, or are they just at gas stations? The data on number of cash registers, that comes from the Department of Health and their annual surveys, and the licensing that they do for stores. So it would be possible for the Department of Health at some point to add an additional question to that licensing or to that the registration forms if it was really deemed necessary to get that information. So that could be possible for future iterations of the map, but not currently possible.
Okay, thank you. We still have a couple questions left, but I'm just going to ask that those folks asking them will just directly reach out to the panelists, as it's a little after 2:30 and we have to close up. So thank you to the Rhode Island chapter for sponsoring today's webcast, and to all of our panelists today, Leo and Ben and Sue and Shayna, for joining us and talking about this great program. And thanks again, everyone. Visit ohioplanning.org/planningwebcast for any issues that you might have or questions. You can direct them that way, and we'll have a PDF of the webcast also available on our webcast webpage again. So thanks, everyone, and have a great weekend.